Mastitis. This is pain in your breast. In mastitis, your breast becomes swollen, painful, red and hot. You are a new mother, you just gave birth, and then you really want to breastfeed your baby, but now your breast is painful and you don't know what to do. This video is for you, because in this video I will be discussing the causes, the treatment, and then complications of mastitis. And if you watch till the end, I will also be teaching you a simple technique that you can carry out to empty your breast properly to reduce engorgement. That is, when the breast becomes too full and swollen. Now let's ride on. Hello everyone, my name is Nurse Esther, the Nice Nurse Cares. I deliver content on healthy living and nursing. If content like this appeals to you, consider subscribing to my channel. Yes, click on that small red button down there. I'm waiting. Thank you very much. So without wasting much time, let us dive in right to our topic for today: mastitis. Mastitis is inflammation of the breast. This inflammation of the breast makes your breast to be red, swollen, painful and hot. If you are brown skin or black skin, you may not notice the redness. It's not easily noticeable when you are black skinned. But we that are Oyinbo people, light skin people, hey, the red will just come out like this. So that is that. What causes mastitis? Mastitis is caused by inflammation. Inflammation sparks a kind of process that your body reacts to. Your body reacts to it with pain and swelling. What causes it is that when there is infection or bacteria, so your body tries to get rid of that foreign body. It tries to get rid of it, and so the breast becomes swollen in response to inflammation. When the breast is swollen, the milk ducts also will be blocked. The breast milk will not easily flow out, and this will lead to engorgement. That is, the breast become big, swollen and painful. They can call that inflammatory mastitis. When it becomes infected, it becomes known as bacterial mastitis, and it can also even become complicated. That is, the fluid will accumulate, can turn into pus, and that pus will become an abscess that needs to be drained out. So you can see how painful it could be when you have mastitis. That is why when the pain starts, when the engorgement starts, quickly take action so that it will not be complicated and lead to that I've just mentioned. Is etc. etc. if you don't understand what I mean. Now let's ride on. What should you do when you have mastitis? Don't stop breastfeeding your baby. Oh, your baby needs the breast milk. The breast milk is still good though. It cannot harm your baby. So continue to feed your baby. Yes, your baby will be happy and look at you. Mommy, thank you very much. So continue to breastfeed your baby. Do not stop. Although it may be uncomfortable for you, but breastfeed your baby. And then what you do also to relieve the pain, because the pain can be so much, you can take over-the-counter medications like paracetamol and ibuprofen, yes, to relieve the pain and the swelling. Another thing that you can do is that you apply cold compress. Cold compress. Put a cloth in cold water and use it to dab your breast gently. Don't go and massage it as if you are fighting with the breast. It's not like that. What you do is that you gently pat it. Yes, give the breast tender, loving care. Another home remedy that you can use is that you can use cabbage leaves. They say cabbage leaf is very nice, so I've not used it, but those that have used it or even researched it is good. What you do is that put the leaves in the fridge. When it is cold, apply the leaves on the breast. just like this. Use it to dress the breast. You know, if we nurses, when we are doing dressing in the hospital, the way we put dressing on the wound, just carry the cabbage leaf like that, put it on the breast, but leave the nipple bare so that the breast milk can flow. You apply this for 20 minutes, or when the cabbage is hot, remove it. You can reapply this over and over until you feel relieved. What you can also do is that take some rest, give yourself some tender loving care. Iyagbemissola, I'm talking to you. Rest yourself. Rest yourself. Yes. When you have mastitis, take time to rest. It's not easy, but you know you need the rest. Yes, your body is telling you that you need some rest. So take time to rest. What you also do is that you know that you have just given birth, because mastitis is usually common within the first 3 months after giving birth, and you know the baby is there. You may even have other children that you are taking care of, but please give yourself some rest so that your body can heal. And you know this period is a stressful period. Your body needs time to heal. This is the time you need people's help. Do not reject help from people. Let them help you so that you can rest. When this phase is over, you can do all the gbogbo in the house that you want to do. All the work in the house that you want to do, you can do it. Iyagbemissola, thank you. So what you should not do when you have mastitis, what you should not do is that you should not wear tight fitting brassiere. That one that will tight you very much and even worsen your symptom. What you do, wear loose fitting bra, comfortable one. Do not take aspirin. Aspirin is not good for breastfeeding mothers. Do not express the breast because the breast is big and engorged and it's full and it's paining you. You now start pressing it out. Make I press am, make I empty am, I want to empty it. No, don't do that because by the time you finish emptying it, you are giving the breast milk more room to fill up again. So by this time, the second time when it will now become full, the pain will double. So don't do that. What you do is that breastfeed your baby, give your baby as much milk as he wants, and then rest. Don't express the breast milk. Say you want to empty it. Do not apply firm pressure to your breast. You say, I want to massage it and press it very well so that the breast will empty. You start applying firm pressure and pressing it as if there's injury in your breast that you want it to heal. The way our grandmother used to press our leg when we have wound those days. Don't go and do that to your breast too. You are causing more harm than good. What the breast needs is tender, loving care. You get it? So after saying all these ones, we have said what we should do and what we should not do. Now let us go to simple technique. That simple technique that I said earlier that I'm going to teach you to empty your breast. Now let's ride on. Before we say that, let me steal 30 seconds of your time. You see that subscribe button down there, that small red button you are seeing below me down there, just so free, click am. Thank you very much. Thank you. So you know, when you did this this video will get to other mothers that are doing all this mistake unknowingly. They don't know that when they do all these things, they are making things worse. So click it so that it will get to them. Now let me teach you that small simple technique that will help you to empty your breast. The first one, you know, the breast, the way God made it is that it has a way it naturally drains itself. We call it in nursing, in medicine, the lymphatic drainage system. That lymphatic drainage system is a kind of drainage system that removes excess fluid from our body. So the one that removes the one for the breast is located here at the front of your collarbone here, and then there's another one under your armpit there. So what you do is that you lie down on your back, lie flat on your back, gently pat the breast towards your shoulder and your armpits. When you do that, you are encouraging fluid to go out of the breast and enter the drainage system. That will empty excess fluid from your breast. Another tip is reverse pressure softening. Reverse pressure softening. That is just big oyibo. It's a simple method. What to do is that Carry this your two fingers, any of your two fingers, put it on your areola. Your areola is that black area, that circular area in your breast. Put it there. Press it gently towards your nipple. What you are doing is that you are emptying the milk dots, because the milk dot is gathered around that black side in your breast, that black area in your breast. That's where the milk dot is like storage for the milk. That's where it's gathered. So you just press your hand there and slide it out towards your nipple. You see that the excess fluid will drain. What this does is that it helps the baby to latch more fully on your breast, thereby emptying the breast properly. Latch means it helps your baby to grab a fuller portion of your breast. When the baby does that, the baby can empty your breast more fully. Some people can have this recurrent mastitis. So what causes this is that the baby is not latching properly. The position is not proper, so the breast is not being emptied well. It can cause recurrent mastitis. So in order to breastfeed your baby well, make sure you are comfortable. Take any comfortable position you like, as long as your shoulder is relaxed and your back is relaxed, and it's okay for you. That is a good position. And then what you do is that make sure you don't lean over. You don't take your breast to your baby. Let your baby come to the breast like this. You see the way I'm demonstrating it? Your baby will come to you like this. Let the baby come to the breast, and make sure that your baby's tummy is touching your tummy and your baby's body is aligned to your body or to your hand, but the neck and the head can slightly flex. Let your nipple point to the baby's chin. Let it touch the baby's chin. When it touches the baby's chin, you see the baby will open its mouth and grab your breast. That is proper latching. It should grab almost the full amount, if not all, of your areola. That is the black part of your breast. And you hear the baby sucking. The cheeks will be full and you hear the baby swallowing. And after feeding, you will see that the baby will feel satisfied and happy and may even fall asleep. That shows that you are emptying your breast properly. If you have questions about how to latch your baby on properly or problems with breastfeeding, you can ask your midwife. Now, if you are enjoying my video, just give me a thumbs up. Type in the video that I am enjoying your video. Thank you very much. Some people are not breastfeeding and they still have mastitis. It is not common, but it can happen. That may be as a result of damage to the breast tissue. Yes, when there is damage like piercing, or even you are plucking the hairs around your nipple, around your breast, that can cause mastitis in non-breastfeeding mothers. And when there is also low body immunity, like in diabetes too, those kind of people that has low immunity can have mastitis even without breastfeeding. Some people can have flu-like symptoms. Some people can develop fever or chills, headache, cold. They'll be shaking when they have mastitis. That is as a result of infection. That shows that the mastitis has become infected. So in this instance, the doctor can prescribe antibiotics for this person. And if after doing all these home remedies and you did not see improvement within 12 to 24 hours, go and see your doctor to avoid complications. Thank you very much for watching. Do not forget to like. See you in my next video.